All right, well, greetings, everyone. My name is Dr. Doublestein, Barry Doublestein. I'm adjunct professor in the School of Business and Leadership. I'm honored to be with you tonight as a host for this second installment in the School of Nursing's webinar series. And we are recording this event, so it will be available for those that are unable to do it, to see it live with us tonight. And also for those who are here and live, you do not have control over your audio or video, but what we do want you to do is to state any questions that you may have in the chat window and or in the Q&A section at the bottom. And we will be happy to take your questions, and we'll get to them in just a moment. So it's a pleasure and honor for me to be able to introduce to you the director of the School of Nursing, Dr. Becky Lee.
Hello, welcome everyone. Thank you so much for coming tonight. We're so thrilled that you're here. And I've found that just in our networking and discussing events with current nurses that there seems to be just kind of a lack of evidence-based practice surrounding the use of personal protective equipment. So what we want to do tonight is to give you the most up-to-date evidence-based information that there is, since there's so much that has been unknown about COVID-19. It's been difficult to manage from a protective perspective with nurses on the front lines. So we have tonight Dr. Jamie Holland, who is going to help clear some of that up. She is a advanced practice registered nurse and has a doctorate of nursing practice from Old Dominion University, is a wonderful nurse, well-versed in lots of various topics, especially underserved population, and really just has a heart for making a difference for others. She serves as an assistant professor of nursing at a local community college. She's also an adjunct nursing professor here with us at Regent. She is, like I said, constantly advocating and really pushes wellness and prevention, so this topic is perfect for her. She's presented both regionally and nationally, addressing many health concerns that the United States faces. She was awarded the APRN Leadership Award from Old Dominion University for the work that she completed in her graduate school, and also has served and researched as an interprofessional coordinator at the Urban Federal Qualified Health Center. So I'm so thankful for Jamie and her wisdom. I'm thankful that she's a faculty with us at the School of Nursing at Regent, and with her advanced practice skills, she's more than qualified to tell us and advise us on how to best protect ourselves. So I'm going to say an opening prayer, and then I'll welcome Jamie to the platform. Heavenly Father, I just thank you so much for this time. I thank you that you have given us wisdom on how to protect ourselves, Lord, and that this virus is not from you, Lord, and it's not your plan for us to contract this virus, Lord. So I pray that you would help us to learn the best practices and how to manage this from a medical perspective, Lord, and a practical perspective, Lord, and that you would just continue to keep this virus away from us, Lord Jesus. We thank you for this night, and we give it all to you in Jesus' name. Amen.
Amen.
Dr. Jamie Holland.
Hi, thank you so much. What an honor. I was listening to the things you've said about me, and I was like, thank you, God. What an honor that is to have been able to do some of those things, and all of those things, really, and all glory to God for that. So I wanted to get started. Let's go ahead and advance the slides twice. This is my quick disclaimer, and this is the presentation was completed last Friday. These things have been changing really quickly, and you can advance to the next slide. But they've been really advancing really quickly, and the protocols have been, I hate to say the word changing, but they are changing, and I'm going to actually explain why they're changing in a little bit, kind of explain it's not that they are changing their minds, it's the evidence that supports, and then there was also levels of protocols that we put into place depending on what our strategies are regarding the level of PPE that we have. So these are actually well defined, and it's not just changing. So just to give you a little bit of comfort, it's not just a whim that perhaps your facility is using, or it shouldn't be. It can be very well guided. So I just wanted to put that out there, though. This was created last Friday, and I just wanted to let you know that please do reference your the CDC, the WHO, and the NIH for updates on these things. If you are actually going to implement anything, reference first. So okay. Today's topics we're going to talk about, this is a winter and not a blizzard, the helpful versus the not helpful. I'm going to ask you to consider the evidence, and I already kind of alluded to that. Evidence-based practices for protection against COVID-19. And there's a couple different names, but we'll go with COVID-19 primarily. And how to primarily utilize personal protective equipment. So make sure that we're not making any mistakes, because it's in the mistakes is where we have the problems and where we end up auto-inoculating ourselves, or coming in contact with the virus. And then maximize strategies for personal and professional use of PPE. That's kind of extending the life of PPE, and discuss and exemplify community efforts. So I have honorable mentions threaded throughout. And then homemade masks, can they be serious? I feel like it's a Jeopardy show, but yes, they are serious. And solutions for sore ears. So I have a little bit of everything in here. So stick with me. All right, so the way that we prepare for winter definitely differs from the way that we prepare for a blizzard. Or the way that we prepare for a storm is completely different than a season. And so there is something really unique in understanding that. And so it's weathering a storm is surviving a storm. When I live on the East Coast of the United States, and so when I get ready for a hurricane, I know that I could be 1 day to 2 weeks primarily without emergency access to many things. And I am pretty well informed of how long it's going to be. I have a good understanding of how big the storm is going to be. This is different. This is more like weatherizing. So, winterizing. Sorry, so that we can adapt and adapting. So this is much more. This is much more about pulling out the winter clothes for the winter season than it is just kind of bunkering. So if you'll move to the next slide. I just put this on here. I wanted to show kind of why we're doing this, why we're winterizing, if you will. And I know we're going into summer, I'm well aware, unless you're in Australia, but I understand. But this is definitely about the ability to flatten the curve. We've heard it said, flattening the curve. And I wanted to make sure that everyone is really clear about what exactly that is. So the way the dotted line across the center there, that is our healthcare system's capacity. And when we talk about capacity, we're going to talk about different stages of capacity later. But with that in mind, we really want that that green, to be where we are. And that is considered flattening the curve. I shifted this perspective here on purpose so that perhaps we could change the way we look at things as far as our bunkering in, to being more about that perspective changed, slight camera angle adjustment, that our journey is really more like that little white car, and we are definitely on that curve. We are working really hard to flatten that curve no matter where we are in the United States right now. That is our goal. This will not only slow the spread, but the evidence that supports it will reduce the overall number of COVID-19 cases. So hopefully that will help just in the visual of we are flattening that curve, so that it's not going to last forever, but it is going to be more of a winter. Slide. And so what you see here, I just enjoyed, because I feel like I know that I have had to go out and wait for the toilet paper to come in off the truck so that I could have toilet paper in my house. So toilet paper is not the answer to flattening the curve. That's not going to do it. And bunkering with a bunch of toilet paper around you and building toilet paper igloos is not what we need here. That's not thriving. We need to be able to find our stride and be able to thrive during this time. And at the end of the day, you'll still have toilet paper to spare. All right, so there are stories across the United States, and I'll let this play. Go ahead. And I'll talk about it.
about 4 days ago, we heard a bunch of people cheering all around the neighborhood, and we're thinking, what the heck is this? So we went onto the internet and looked it up, and it turns out that everyone's cheering in support of medical staff and nurses and everyone that's out there really on the front lines fighting coronavirus. And so this entire neighborhood has really come together, and it's escalating very quickly with like pots and pans and everyone cheering and lights and everything, because everyone is just so thankful. I always knew that there was a really great sense of community here in Midtown, but this just kind of solidifies it. Like, even in these really tough times, we have so many people coming together to really kind of show their support and show their togetherness. And I don't know, it really gives you hope in a time of darkness, and I think it's amazing.
Thank you for sharing that. So yeah, this is how we can have community, and this is a way that we can really encourage our community. Can you imagine getting off of work every day and hearing that as you came home? You would feel like such a hero, such a champion. If we can kind of inspire our community, inspire those around us for all of the small wins that we're doing, and cheer each other on like that, that is how you can stay together, and how you can shows community support, and also do the social distancing and uphold all the recommendations and keep yourself safe. So it's about inspiring community and not just bunkering in with your toilet paper. All right, so this slide, you see these two little sweethearts. This is about 10 years ago, and these are mine, and two of mine, and they are definitely exhibiting problems with their PPE. So it's definitely time to talk about personal protective equipment. So yeah, I'm sure that you've picked up on the inconsistencies of touching one's face as well as having one's nose exposed here. And these two behaviors increase the risk being exposed to COVID-19. And I just happen to love this picture of them. So evidence-based practices, if you'll move to the next slide. Evidence-based practices for protection against COVID-19 for the general public, and I'm going to go over the general public and then also the professional side, so that we have two different things. Is guess what? We get to function professionally, and we get to, as a healthcare worker, we also get to function professionally and in the general public. So, so first and foremost, all of this information is coming directly from the CDC or derived from the CDC, so that you can, if you have any questions, you can pull all of this up. It's very easy to find. Evidence-based practices and protection for COVID-19 for the general public starts with knowing how it spreads. So you have to understand where it's coming from, so that how can you prevent something if you don't know where it's coming from, right? Or what's happening with it. And the novel part of SARS-CoV-2, which is COVID-19, is difficult. So with that, knowing where it's coming from, but we do know quite a bit about it. And we do know that there's not a current vaccine that we can use. However, we do know that one is being prepared, and we know that the best way to prevent an illness is to avoid it, and that the virus is thought to be spread mainly from person to person. So there is some evidence of it being spread on contact on plastic and this, that, and the other. And yes, we do need to use precautions there, but primarily it is spread face to face, person to person. Between people who are in close, it's between two people who are in close contact with one another within the 6 feet. That's where we get this from. Through respiratory droplets, it is considered respiratory droplet. And I'll explain in the professional side why that sometimes gets a little confusing. And then it is considered respiratory droplet, and these droplets can land in the mouths, noses of people who are nearby, and possibly can be inhaled into the lungs. And this is how we spread COVID-19. It's not the only virus, or even it's not the only virus that we spread this way, but it's definitely how we're doing it here. Studies support that COVID-19 may also spread by people who are not showing symptoms, which we are definitely aware of. So yeah, just because you don't have symptoms doesn't mean, and that is one of the biggest problems with this virus, is just because you don't have symptoms doesn't mean that you aren't carrying it, or you're not a vector carrying it, or a vector, right? So, all right, so what we have to do is what everyone should do is we have to wash our hands. I know, I'm going to say that a whole lot today. We have to wash our hands often with soap and water for at least 20 seconds, especially after you've been in a public space, or after blowing your nose or coughing or sneezing. Those are kind of obvious, but like, let's just remind each other that's really important. If soap and water are not readily available, that is always the best. Warm water and soap, that's always the best. But if it's not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry, and that is acceptable. Avoid touching your eyes, nose, and mouth with unwashed hands. I'm going to say ever. Try not to touch your eyes, nose, and mouth. That is just that's a primary mode of transmission. Avoid close contact. So avoid close contact with people who are sick. We know sometimes that becomes inevitable when it's in your household, which means you go into the same isolation that your family member is on. Stay at home as much as possible. Put distance between yourself and other people. Remember that some people without symptoms, like I already mentioned, are able to spread this virus. So you need to be consistent in keeping that distance, because you don't know. You just don't know who you could be exposing, and that somebody else could really be at risk, especially if you're in the grocery store or things like that. And we'll talk a little more about that. And then cover your mouth and nose. We talked about that, but they're saying cover your mouth and nose with a cloth face cover when you're around others. Okay, so the very first thing, as soon as that came out, I posted it on my social media, said everybody cover your face, because as soon as it went to public, that was the protocol we were going to use. I was 100% about it and supported it. And my brother, the very first thing he asked me, do they mean a mask? Yes, they do mean a mask. They don't want you to use the resources from the hospitals and take from the supply of the hospital. So you don't have to use a surgical mask. You don't need to use an N95 mask to go to the grocery store. But they do want you to cover, and so you can use a bandana, and I actually will show you some options at the end of this of how to make a very quick and easy face cover without taking away from our supply chain to the hospitals and the healthcare workers, where obviously this is far more important that they have specific masks, especially the mask, but all of the PPE. The cloth face cover is meant to protect other people, so that's a really big piece to remember. It's meant to keep your germs to yourself, so that is the point. And it's not meant, it never was, and it is not intended for the healthcare worker. We have to use them, and I'll get into that, but I'll explain why. And its supply issue is really what that's about, but that's not the intention of a face cloth mask. Does that make sense? Cloth face covering. There we go. And always, and even with a face covering, a face cloth covering, please maintain your distance of 6 feet. It's not a substitute for social distancing. A cloth face covering, it's a little bit of a tongue twister for me tonight, needs to fit snugly but comfortably against the side of your face, right? It needs to be secured with either ties or ear loops, and it needs to allow for breathing without restriction. It needs to be able to be washed, and it needs to be dried without damaging the shape. So you need to be able to clean it, right? That's the point of reuse. And then always, I mentioned it already, but please cover coughs and sneezes and use a tissue. And then
Dr. Holland,
yes.
Excuse me for interrupting. A question came out is, do you recommend to wash the cloth after each time wearing it, or can you use it a few times?
It depends on how long you're wearing it and how soiled it, how wet it becomes. And so if I'm running in and out of my Wawa to pay for whatever I needed to pay for in Wawa to get gas or whatnot, then I'm not going to take it home and wash it that one time. Well, when I take it off, here's the trick. So I will go into the store, and I put it on, I have hand sanitizer. I have a big pump hand sanitizer sitting right where my cup used to go. And I wash my hands, I put on my mask. I don my mask, I put it on. So then I walk into the store, I do my business in there. I come back out, I sit back into my car, and I wash my hands and I take it off, and then I put it in a specific space that it doesn't touch anything else. Like it's just like I have a space I can hang it, and that's where it stays. So I'm not touching a whole bunch of other things. I'm not trying to spread more germs, and then my hands, again, you get to wash them. So that's how you can keep yourself, because what is on the mask, if you did happen to have any, I just treat it the same way as I would in a hospital setting. Honestly, that's how I do it. So no, you don't have to wash them every time. Remember, this is about protecting others from you, though. So so you know, that is the goal. So if it smells like Doritos, it's probably time to wash it. But no, like you can wear it a few times, I would say, and not have any problems with it. Does that make sense? Okay. And then for cleaning and disinfecting services that are touched, you need to clean and disinfect daily. So if there's something on so let's just say it's your kitchen counter, and if there's something on the kitchen counter, you have breadcrumbs. First, you clean the breadcrumbs, and then you disinfect. I highly, highly, highly recommend that you actually read the disinfectant's bottle. Actually read how to do it, because you will be surprised at how long some of the disinfectants need to sit on a surface for it to disinfect. So I'll leave you with that, but definitely there's different ones, and you need to read on them. So Clorox and Lysol, they all have specific amount of time that they need to sit to kill certain things. So before you wipe them again. Okay, next slide. All right, so how to maintain the essentials safely. So how do I keep my house running and not put anybody at risk? So as communities across the United States take steps to slow the spread of COVID-19 by limiting close contact, we've all been faced with the new challenges of questioning how to meet the basic household needs, such as buying groceries, getting medicine, going to the bank. The following information provides all of these different things. That's what I'm going to talk about: how to protect yourself while you're shopping, hand sanitizer, using hand sanitizer. We've touched on it. Again, I keep hitting on this, but cover your nose and mouth, and when you cough or sneeze. And then how to order online if you must. These are all very, very, very key things. I was shocked at how much I can have delivered to my house, like that I never need to leave my house. I have been able to get all of my groceries. I was able to do most of my banking. I've been able to do it. You just have to ask. So there's a couple of great things, a couple of great apps that I personally have used. I've used, well, everybody knows about Amazon, thankfully, and I am very grateful for them. But I'm also concerned about my small businesses. They've been delivering. They've been doing meals, they've been doing all sorts of things, and they've been doing a great job here locally. They've been doing a great job maintaining their social distancing and making me feel like they're doing a good job, and I'm looking. So like they're doing a good job with it. Yeah, you can order through Instacart. I was able to get all sorts of things through Instacart. Again, these are just little recommendations. You can download them, and they're not hard to use. I was able to have groceries shipped to my mother-in-law in a different part of the state. I didn't want her going to the grocery store, so I just ordered them, and they delivered, and it's been working charmingly. And I can make sure that she's not taking unnecessary risks to go out. I even get the dog bones that way. So yeah. Definitely order online. You can do most of your banking online. It's amazing how much you can do that way. It's shocking. I can put a check in the bank, all sorts of things. They also recommend that when you do go shopping, if you do have to go in the store, try not to have to touch the keypads or anything like that. So you can use cashless exchange, but you can use like your, again, I'm Apple, but like Apple Pay, they have multiple different types. I mean, there are many different types of Apple Pay type of apps, but you can use those, and then you don't even have to touch touch any of where everyone else is going through. All of the money is being handed back and forth. They highly recommend cashless, and definitely if you can even not touch the kiosk there, that's preferred. If you do go out, I'd also add bringing your hand sanitizer with you, because I have had to touch the keypad and it just doesn't feel right anymore. So wash your hands when you're done with that too. If you must go out for an item, disinfect the shopping carts when you go in. They all have it. It's all available. If they don't have it, I'm probably not going in the store. Definitely disinfect them, let them dry. that's a really big part of disinfecting something. I mentioned it earlier, but once you wipe it down, it's not disinfected until it dries. And then, yes, practice social distancing. I love my Wegmans here when I go in, because there are some things you just can't get. At this point, we've had kind of peaks and what you can, when you can get everything, and then times where I really haven't been able to get just about everything. And so I have gone in wearing a mask, and they have these wonderful little lines on the floor that tell you how to stay apart, 6 feet apart. Just don't cross those. Like, try to maintain that as best as possible. And remember, a mask does not substitute social distancing. Okay, slide. Let's see. So right here is, I just liked this infograph. It helped me to kind of understand. I'm very visual, and I thought you might be too. And so I thought that this was really helpful in understanding how social distancing does help, that I am doing this for a good reason, and how big and how drastic this can be. So the visual capitalist, you can find them online, is they love to do this. They love to show you the visual side of things. And the math behind, and they wanted to show us the math behind social distancing. The calculation that was used here is from Siner Laboratory, and it's a research lab located in in the Moores Cancer Center in the University of California, San Diego. It's using a summation formula, and it basically shows you the difference between, and if you go to the site, you can see more information about it. This is just a piece of it, but day 1, day 5, and day 30, and what would happen with different levels of reduced activity. And so with no social distancing being practiced, one person infects 2.5 within 5 days, and 406 people are infected within 30 days with no social distancing. That tells, those numbers are outstanding. 50% reduction of activity on your part is, you may infect one and you did have COVID, or you carried it, you were the vector, you would infect maybe 1.25 others. So, obviously we can't infect 1.2, but 1 to 2 people. So 15 people would, and even with just a 50% reduction, you are reducing the amount of people to 15 in 30 days. And at 75% reduction in your social exposure, which I am definitely at, a person infects 0.625 others in the first 5 days, and only 2.5 people may become infected as a result in 30 days. Those are huge numbers, and that's the difference between 406 with no social distancing to a 75% reduction in your activity to only infecting 2.5 should you be a vector or actually have symptoms of COVID. So if you had COVID in any which way. So these are estimations, but they've done a lot to make these as credible as possible. Yeah, I'm going to move to the next one, but I did love seeing this and hope that encourages you to practice social distancing. All right, the evidence, I wanted to talk about the evidence. The evidence is growing, and I did mention this early on, but the evidence is growing and not changing, and it's not as much changing, it is growing. So as things grow, and we like a body of evidence to grow, right? That is the goal of evidence. That's the goal of research. We want to add and contribute to the our body of knowledge about a subject, and so we want to see that growth. But that means we also become informed by that evidence. As we become informed by the evidence, the protocols change. So as we progress through time, we're constantly learning more through scientific reasoning, and from that, our plans change. From every time. So if you were to grab something off of a stove and it was hot, and you realized it was hot, right? You let it go, and then you grab something else that you are now informed that it is hot. You're going to grab your hot pad, and they're going to pick it up then with a hot pad and protect your hand. So there are things that will seem like they're changing. It didn't really change the fact that there was a flame, but it does change how we react once we know that it's hot. And so for that, with that in mind, it might be a good idea to think of it as more as we are just becoming informed. When you're looking at your sources, make sure that you know the sources that you are pulling things from. There is a lot out there right now. I do practice what I call my my social media hygiene. So I do practice that. That means I get on and I check it out, I see what's going on, and then I shut it off, because it can be quite consuming. But what I recommend is that you definitely check it out, but I go to my source. So I don't turn on my news source. I go straight to the CDC, the WHO, the NIH, and the VDH, which is the Virginia Department of Health. That's where I live. And I find out that I have things that comes directly into my mailbox. I have updates constantly, and every day I tend to get one or two that I read through and kind of see where we actually are. I do go looking for certain things. I have been looking at, when I hear certain theories that are out there, I will definitely research them, absolutely. But I go to peer-reviewed journal articles. I go to the source and not to a lot of the opinions that are out there, because there are a lot of opinions that that are not terribly credible. And just be careful. I don't want to discredit anyone, but at the same point, be careful of what you allow your mind to believe. So know your sources and then compare your sources. So what I expect the CDC, the WHO, and the NIH to all be saying something really, really similar. They might be expounding in different areas because they all cover different ground, but like they should not be in conflict with each other. And I haven't found that to be the case. But if they were, then I would need to continue to go to the research myself and read through that and find out what's happening, why that conflict is occurring. Usually it can be explained in that. But just so you know, that's how I do it, and I highly recommend it. It will quiet a lot of the noise that is out there that is not related, that's not credible. So know your sources. There are things in research that are absent but implied in statements. And so what I mean by that, what is absent but implied? Okay, this one's not even absent, but it does say quite a bit. When you have we have a new virus, right? However you want to say that. You have a new virus. What are we saying with that? We're saying we don't know. We're saying that's what's absent. You're not hearing, we don't know what this is, what exactly we're dealing with. So, but it is implied when you say that it's new. That means there's going to be even more changes than what there normally is when we add to a strain. This is new to the human body. We are researching it as fast as we can. We are looking at it in every which way we can think of, but this is new. So that means there may be some things that are going to change as we learn. Actually, they're telling you that it is going to change, and that the evidence is going to grow, and so our protocols are going to grow, if that makes sense. So most protocols this is also absent but implied, most protocols are recommended with a contingency plan. That's just responsible. It's not that there's not, it's kind of like your ideal, which is where we are. That is our standard or conventional way. So that's where we like to function. That's where the evidence says we should be functioning. And then you have and then you'll have your plan B and you'll have your plan C, which I will get into how those are actually kind of working out. But, and we have seen all of those, and that's something that healthcare hasn't seen since I've been nursing, is having to go through all these different levels of protocols and reducing from what our standard or conventional capacity or our standard or conventional ways are. So that has been definitely something new, but there is actually guidelines on that, which it was very reassuring to me to know that there is actually guidelines as to what to do with the if-then. So the if-then clauses, there is something that you can do. And so, okay, keep it moving. So you have standard or conventional, and I use both because they are used interchangeably throughout the CDC, the WHO, and the NIH. Contingency and crisis clauses. Slide. So this is for your evidence-based practices for protection against COVID-19 on the front line. So this is for my healthcare workers. Here we go. So standard and transmission-based precautions, respiratory and droplet, and then I want to talk about aerolization too while we're on this topic. So we'll talk about that, and then hand hygiene, proper PPE utilization, respirators, eye protection, gowns and gloves, and the if-then standards, which I just introduced you to. So currently. Currently, SARS-CoV-2 or COVID-19 has been transmitted by respiratory droplet. That does not mean that it cannot be temporarily aerolized. What do I mean by that? Because I've heard people I've heard about this, is it airborne? Is it not airborne? And so when it becomes, what aerolized means is that it becomes temporary. It's essentially airborne temporarily in a small confined space. So, pardon me. So during specific, and that can happen during specific procedures and events such as if you're suctioning a patient, it can become aerolized at that point. If they're intubating a patient or extubating a patient, it can become aerolized at that point. Those are all times where it's really important to have that N95 versus the surgical mask, because I know that we are in a different level of capacity right now. This has caused some confusion though regarding the current recommendations. I just want to make sure that's really clear. It is considered a respiratory droplet. That is where we are. It has been consistently considered respiratory droplet. But I wish that it was a little more clear that it can be aerolized. So we need to adhere to standard transmission-based precautions, right? Plus the level of transmission that it is. So standard precautions plus the transmission-based, that's what we put together. So standard precautions assume that every person is potentially infected or colonized with a pathogen that could be transmitted in a healthcare setting. That's normal. That's what we go into every single day. That's not changing. The elements of standard precautions that apply to the patient with respiratory infections we apply the same elements that we would for any respiratory droplet type of standard or type of precaution. Attention should be paid to training and proper donning. So I'm actually going to show you exactly how you're supposed to put it on and exactly how to take it off per the CDC so that we don't have any kind of auto inoculation. So absolutely need to be 100% careful. It has to be done right. And I highly recommend, pardon me, that you watch each other put on and remove and function until you feel really, really comfortable functioning and caring for a patient while you are wearing all of your precautions. Yes, so healthcare professionals who enter a room with a patient who has suspected or known COVID-19 should adhere to your standard precautions. But that wanted to make a really good point. The CDC did make a point. Several good points, but that you also need to be aware that if we are rationing our PPE, that we would have to ration the N95s to be able to care for actual airborne diseases, because the entire hospital is not COVID-19, although it does seem like it right now, and definitely that's what the news would have you believe. But should someone have tuberculosis or varicella, you would absolutely have to have an N95 to care for that, and that is an airborne. Those are airborne precautions for those viruses. So definitely be aware of that. So just to kind of understand the perspective of the hospital. Hand hygiene. Healthcare providers should perform hand hygiene before and after every patient contact. You know this. Contact with potentially infectious material and before putting on and removing PPE. It sounds a lot like what we're doing out in public, right? But we aren't putting on as much PPE, but we do put on a face cover. Healthcare providers should perform hand hygiene by using a hand sanitizer of 60 to 95% alcohol. That's really important. If it doesn't have that in it, it's really not going to work. It's just going to make your hands smell nice. Or wash your hands with soap and water for at least 20 seconds. If hands are soiled, use soap and water. This isn't anything new. And then healthcare facilities should ensure that all hand hygiene supplies are readily available to every person on the floor in every care location. And that is something that they should be providing to you. There shouldn't be any question there. And I haven't heard of that being an issue, and I hope that's not the issue for anyone. Employers should select PPE that's appropriate. So when they say is it appropriate, it should be in compliance with OSHA and NIOSH for the actual N95s. So and you can look on the box and it'll tell you. Some of them say it, or it's printed right on the N95. And again, you do definitely need to know how to properly use it. Any reusable PPE must be properly cleaned, decontaminated, and maintained between uses. Facilities should have policies and procedures on all of this, and they have recommendations for your facility should you have any kind of issue with that. So if you have any questions about that, you can bring this right to your facility. This is what they are recommending in order to preserve the PPE for longer. So strategies for optimizing your PPE supply. N95s or respirators of a higher level, like your PAPRs, you can use those, but make sure that they are clean between them. The N95s, just make sure you're following whatever guidelines you have at your facility right now, and that they are in compliance with the CDC. Disposable respirators and face masks should be removed and discarded after exiting the patient's room or care area, and then closing the door unless implementing extended use or reuse, and then perform hand hygiene after removing the respirator or face mask. This may be a little different than something that you have done or been practicing. This is the recommendation of the CDC. Again, I recommend that if it doesn't match what you're doing in your facility, that you bring it to your facility and find out why. This is the best researched in multiple areas of what they recommend. I don't think that you should go rogue, but definitely provide the information and find out why or because it might just be a matter of bringing it to their attention. When the supply chain is restored, facilities with respiratory protection programs, so that means that we're conserving, so we're using them longer than what we probably have, what's recommended, or we're leaving them on for extended use, so you're putting on one mask for the whole day, which is really hard to do, but you're doing a great job with it. Then if that is the case, as soon as they have supply, it needs to go right back to your conventional or standard capacity, what you always use. And that is what the CDC recommends. For eye protection, your contacts and your glasses are not considered eye protection. So please please make sure that you're putting on a shield, either a face shield or something that goes over your flips that go over, or goggles that go over your glasses or contacts. Those are not considered eye protection. Remove eye protection before leaving the patient room or care area. And reusable eye protection, such as goggles, must be cleaned, disinfected according to the manufacturer's reprocessing instructions. Again, instructions are really critical on this. Gowns, put on a clean gown every time you enter a patient care room, patient care area or the room. So depending on if you're on extended, if we're using the same gown all day, because if you are on a COVID-19 unit, it's really quite common that you would go in, put on you are now in a patient care area. When we're talking about patient care areas, the whole area is considered contaminated. We're going to do the best we can to reduce transmission patient to patient and increasing viral load, but we are going to wear the same PPE all day. And then so make sure that you have, but you do definitely want to have the gown, and you definitely want to have on gloves. And you can you don't need to have sterile gloves. Just the normal clean gloves are plenty. And disposable gloves are great. And we are not trying to extend the wear on those beyond what they can manage. Okay, and next slide. So this is what you should look like when you go in to care for your patient. The lovely yellow gown, the gloves that are on, your isolation gown. Now, one pair, you don't need 2 pairs of gloves on at a time, and the N95, and then a face shield or goggles. I personally like the face shields. I just like the extra protection, but that's what I like. I would take what I can get so long as I can get it on the unit. And then if that is not there, if you don't have the N95, it's basically the exact same thing, but in your right-hand column there, you will see the acceptable alternative PPE use, which is the face mask, which is like your surgical face mask, which again, this is why we don't want them out in the grocery stores, because we need them here in the hospital. So, all right, next slide. This is how you will don it, and I am going to keep moving to the next slide because I'm going to let the CDC actually demonstrate how to do that. So your protection is in the details, and here's how you practice. How you train is will be the same way that you will actually perform, that is evidence-based, that is foundational, that is across the board, that's not just in healthcare. So how you practice is how you will actually perform, and then educate others that there is a right way, because I have seen so many errors in how to don and doff PPE from people who know and who have been nursing for years and years. So please make sure, there's also a nice way to educate.
Safely put on personal protective equipment, or more commonly called PPE. We will demonstrate one way to appropriately put on or don PPE. More than one donning method may be acceptable to your facility. It's important that you receive training, demonstrate competency, and practice your healthcare facility's donning procedure.
All right, and we're just going to go right into the next one because of
Try and
time.
gather the proper PPE.
Go ahead. Oh, did it go through?
How
Was
to
it playing?
safely take off personal protective equipment, more commonly called PPE. We will demonstrate one way to appropriately take off or doff PPE. More than one doffing method may be acceptable to your facility. It's important that you receive training, demonstrate competency in removing your PPE without contaminating yourself, and practice your healthcare facility's doffing procedure. Remove and discard your gloves. Gloves can be removed using more than one technique. For the glove and glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room.
All right, so we can
Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again perform hand hygiene after removing the respirator or face mask. You have now completed the doffing procedure.
Great. I wasn't sure if the video had glitched on me or if it was still moving. Thank you for your patience. So strategies. So now you can see how the importance of knowing these steps. I had one report of a nurse, an RN, that wasn't used to wearing PPE often, and when she had been floated to a COVID unit. And when she came out of the she came out of the room with all of her PPE on, and then she took it off and then she wrangled it in a circle, just spreading it all over the place. So that's just not how we do it, and it's just one of those areas that we definitely need to be educated about, and that we definitely need to educate others about. It doesn't even make sense to do that, but that was what happened. So she was educated. Great opportunity. So strategies to optimize the supply of PPE and equipment. So according to, and I mentioned this a little bit earlier, but I did want to put a little more structure to it. So there are 3 different levels that we talk about on a regular basis, and that are listed out, and they're easy to find. It would actually be, first would be your standard capacity, also called conventional capacity, and then it would be your contingency capacity. We've been at contingency capacity for a while, and we've even dipped to crisis capacity, and we'll talk about those here on your next slide. So when you're on conventional capacity measures, or they call them capacity, they call them protocols, they have a different, but it's conventional capacity for this purpose. The measures consist of providing what we always do. That is what you learned in nursing school. These are the standards of care. When we have a contingency capacity, measures may change daily based on how much PPE you have, based on the capacity of the hospital, what we're looking at, based on the need right there. So we may find that we are extending the use of PPE, which is what we've been doing. I know in our area, that's what we've been doing. We've been extending the use of it, wearing it all day. So these practices are used temporarily, and they are specifically during COVID-19, specifically for the N95 respirator shortages. And then your capacity strategies, capacity strategies, crisis capacity strategies that these do not commensurate with the US standards of care. This is not the norm. This is crisis. There's a reason they call it crisis. And these are included, and this is when we're talking about homemade masks in the hospital, and we've also been using homemade masks in contingency capacity to help extend the wear of the surgical mask and the N95. So there's ways that you can help extend the life of those. But when we're down to just having a face cover, a cloth face cover, or a homemade mask, we are talking crisis capacity. And again, as soon. So I really would hope that there's not a facility that has a storage that is full of N95s and healthcare workers and nurses on the floor that are wearing homemade masks. As soon as you can get them, they should be, you need to go back to at least contingency and hopefully conventional capacity. And then slide. So these are some of the of nurses that I have had the privilege of training. And yes, we have been, like I mentioned, in the contingency capacity, and this is how they are using their masks. They wanted to make sure that I let everybody know that they are not actually on a patient care floor right now, and that's why they're so close together and whatnot. They were very specific about how I use this picture. They took the picture for me so that I could show you how it looks. And then I wanted to show you, this is what happens with the if, then, and the crisis, and you can make these masks at home, and it's really easy. They're really not hard to do. If you can sew at all, most of my nurses that I know have made them with a needle and thread. I've helped them out with sewing machines and had people in the community sewing for them, but they're really not difficult. Everyone needs a mask, so I just started with a plan. My plan was make masks and see where they needed and see who needed them, and then don't forget to laugh. Just don't forget to laugh. This is, have some fun with it. This is an event. You will be. This is part of history. This is something that you will be able to remember and talk to your kids about. This is something that I know it's not fun right now, but find a way to laugh through this. I love this little seamstress here who's just found some joy in making masks, and so find the joy in the small things. And then my next slide. Is how to, if you're really like, I don't even know how to thread a needle.
With items you can find around the house, like an old scarf, a bandana or a hand towel, or you can make a face covering out of an old t-shirt. Fold it to the middle from the bottom, fold it to the middle from the top, fold it again to the middle from the bottom, and again from the top, and then 2 rubber bands, one on one side and one on the other side. Then you fold either side to the middle, and you have yourself cloth face covering. It's that easy.
So in case you are concerned about not being able to thread your needle, absolutely, you can get 2 rubber bands. I'm going to recommend that if you get 2 rubber bands, if you get large rubber bands and use one of these nice little contraptions that we've been able to make with 3D printers and buttons to hold that on your head, because it will wear your ears out. I have multiple people that I know that are using their own 3D printers. They're taking and they're creating what you see at the bottom there. That little, it's like a arrow without an arrow with 2 tails, and it's completely adjustable to anyone's any size that you need, and it takes the strain off the ears. If you do end up wearing a mask for a while and you have, say, rubber bands on it or some elastic on it, you will feel the strain on your own ears. Imagine doing that for 12 hours, and then imagine doing it for 14, and then multiply that out times 3 if you're not actually in the healthcare profession, and you'll understand the need for these little devices. I loved the little monkey here that she had. She used that. It worked great. And then also someone was kind of crafty, and they were able to knit or crochet the little holders. And then another person just sewed buttons on her headband. And then I found these lovely little mustaches, which are wonderful. And you can put that on the back of your head and it'll hold them. And you can get them off Amazon for $5, and you get a whole bucket for your whole floor. So anyway, that is what I have on that. And I just wanted to make sure that I thank you so much for standing in the gap as you do. And thank you for all of the things that you have done so far. And I'd be happy to take any questions you have. And yeah, I really appreciate you.
Thank you, Dr. Holland. At this point, we have no additional questions.
Okay.
And we want to thank you for the work that you've done, your efforts, and providing this information to us. And Dr. Lee, would you like to close our meeting with prayer?
Sure. Thank you so much. And thank you so much, Dr. Holland. That was amazing. And I learned some new things, and it's applicable to everyone, for general public and for healthcare workers. So I hope that folks will share this video and just spread the word on how to really properly handle this pandemic.
Yes, please.
Absolutely. And I also want to share a surprise. So I'm doing my confetti surprise.
Aww.
Is a $5,000 scholarship for anyone that wants to join the RN to BS or the MSN program. Woo!
Nice. Wonderful. Yay.
Isn't that exciting?
Yeah.
Yeah, so we're offering a $5,000 hero scholarship for anyone that is interested in joining our summer or fall cohort into the RN to BS or MSN program. Okay. And there is a special link and landing page for that. So if you want to come and join us, we would love to have you. On that note, I will close us in prayer, and thank you again so much. Heavenly Father, we just thank you. We thank you for this wisdom. Thank you for Jamie's ability to collect all of this information and to compile it in such an efficient way, Lord, that we can all learn from, Lord. We know that your plans are good for us and that you want to teach us how to protect ourselves from this virus. So, Lord, I pray you would help us to share this information and to share it with our loved ones and to nurses that are here locally and even globally, Lord, so that we can continue to save lives. Jesus, we thank you and we praise you and we give you all the glory. In Jesus' name, amen.
Amen. Thank you so much for the opportunity. I appreciate you.
Wonderful. Thank you all for being with us for this second session, and we look forward to next Wednesdays. Be looking for your links, and we'll be excited to join again together. So thank you for being here, and have a good night.
Thank you. Good night.
Good night.